Hey everybody, I hope you're having a great day. Today I'm going to talk to you about a postural restoration squat and what we want you as an athlete or as an average human that sits in a chair to be able to do with your pelvis and your rib cage. And then for those of you, we're having just a lot of people recently that have injured their backs going under load with their fall sporting activities. And I kind of wanted to explain a little bit about what we want to look for your safety when you're going under load in a weightlifting type of activity. In PRI, we want to make sure that your pelvis is in a neutral position. We have PRI objective tests or posture restoration objective tests that show us that your pelvis is in this position. And when your pelvis is in this position, it has the freedom to move back and forth correctly when you walk or when you run or when you jump. With the PRI squat, we want to have your pelvis to have the capability of being in a neutral position, and we want your rib cage to be able to stay down. If your pelvis comes forward, it hyperextends your back, and when your ribs come up, you're going to load with your back. And you're going to splint through your joint of your back, and that can create any spondylolisthesis, spondylolisthesis, any of those S words that can hurt your back. You're hyperextending. So in PRI, before we want any of our athletes or recreational people to go under load with a weight in their hand, we want to make sure that they can do a PRI squat. And a PRI squat is not a squat we want you to do under load, but a squat that we know that we have a pelvis in a good position that has the capability of going forward and back and is not stuck in a hyperextended state to hurt you. So with the PRI squat, we like to have your feet hip-width apart, your arms come forward, and we want you to tuck your bottom. We call it a pelvic tilt in therapy. So with some of my patients, I say pubic bone to head. So you want to make sure that you're tucking your bottom. Please do not misunderstand. I never said to over tuck your bottom. But if you're in an anterior pelvic tilt or a hyperextended state, it might feel like that to you. But when your pelvis comes forward, your ribs come up. This is pulling apart. This is getting compressed. We want you to tuck your bottom. Weight through your entire foot, and you're going to reach forward with your arms to help get your ribs to come down. When your ribs come down, we want you just being able to get into the position, and we want you to be able to come all the way down and at least be able to get parallel where your knees are level with your hip, and to eventually be able to come all the way down and not fall backwards. See how I'm keeping my feet flat on the floor, and to be able to push back up. If you can do that, or at least get parallel with your hip level with your knee, then we would feel more comfortable as an athlete or a recreational athlete than going under load. Because then we know you have the range of motion of your pelvis to go back and forth, that you can go from a neutral pelvis to extension when you're going under load, but not going from extension to hyperextension when you block out with your joint in your back and hurt yourself. I hope that makes sense. Have a great day.